Hi, we have decided to do our infectious diseases presentation on pertussis, more commonly known as whooping cough. This project was done by Lydia Clark, Amy Zwart, Brianna Getty, Lauren DeVolin, and Kim Pullen.
Signs and symptoms. Whooping cough usually starts out with cold-like symptoms. These symptoms usually include runny nose, mild fever, and mild and dry cough. The cough may become more aggressive as the infection gets worse. It usually ends with a high-pitched whoop sound. Some symptoms may be as aggressive as vomiting or extreme exhaustion due to the amount of coughing. Infants are more susceptible to this infection and need to be monitored closely for pneumonia.
Stages of signs and symptoms. Stage 1 is called the Carter Hall stage, and it can last around 1 to 2 weeks. This is where the cold-like symptoms appear. The infection is also extremely contagious at this stage. Stage 2 is called the paroxysmal stage, and it normally lasts from 1 to 6 weeks, but can also last up to 10 weeks. This is where the vomiting and extreme exhaustion come into play due to the aggressive cough. Stage 3 is called the convalescent stage, and can last about 2 to 3 weeks. This is the recovery period. The cough lessens, but the host can sometimes still have random coughing fits.
Transmission. Whooping cough is highly contagious and is contagious even before signs and symptoms appear. It is contagious until about 3 weeks after coughing symptoms start, or about 5 days after starting the prescribed medication. Whooping cough's main source of transmission is through coughing and sneezing. If someone coughs and you breathe in the bacteria, you have a good chance of getting the infection.
Ottawa Public Health. If a child contracts whooping cough, they should be excluded from all school or childcare for 3 weeks after the cough starts or 5 days after starting antibiotics. Ottawa Public Health strongly advises you to report any cases of whooping cough.
Childcare Center Prevention. When working in a childcare facility, you must be up to date on all your immunizations, including whooping cough. We also need to strongly advise parents to keep their child's immunizations up to date. It is also a good idea to emphasize the importance of covering your mouth when you sneeze or cough to children. Cleaning any toys or surfaces in your facility will also help prevent infections.
Childcare Center Procedures. The director of the facility needs to be immediately informed if any child starts developing symptoms of whooping cough. A letter also needs to be sent out to all parents explaining how whooping cough is spread, symptoms to look out for, preventative measures, and the contact number for any further information about the infection. If any children in the facility have not been immunized, they need to be sent home for 5 days or 21 days if they do not take antibiotics. Any parent with a child with cough symptoms needs to seek out medical attention to rule out whooping cough.
Role of parents and children. Parents need to be attentive to any signs and symptoms, and in order to do that, they need to be knowledgeable as to what they are. If a parent suspects that their child has whooping cough, they need to take their child to the doctor right away. Only a healthcare professional can properly diagnose whooping cough. If the child has whooping cough, it is extremely important to keep the child at home. The child needs to be secluded from contact with anyone other than the caregiver. During home care, the parent needs to make sure to give the child small meals, keep them hydrated, get help with home care from a friend or relative, and keep the child away from any lung irritants. This brings us to the end of our presentation. If you have any questions, please feel free to ask.